Hi everyone, I am so happy that you're here. Thank you for tuning in. For those of us who are new, my name is Stacey and today I'll be looking at some of the pros and the cons of working in the US versus abroad as a nurse. And so I want to take this opportunity to say to my new viewers, if you're here by chance, if you're here just by, by knowing about the channel, I want to say thank you so much for being here. Please go ahead and like, share, and subscribe to the channel. Turn that notification bell on. If you have a friend who is a nurse, or somebody that is just interested in the nursing field or just wanting to hear stories about nursing, then this is the channel for you. ThinkNursing is the channel for you. And so today I would just love for you to go ahead, like, share, subscribe to the channel and turn that notification bell on. All right. So we're going to look a little bit more into nursing abroad and what it offers. And so one of the biggest things that nursing abroad offers is the opportunity to expand your nursing skills or make a global impact as a nurse. It's going to be a rewarding experience when you're able to work in the US or work anywhere, outside of your comfort zone, because you're providing care in another place to somebody else and they're going to be experiencing all of that comes with you, your culture, your nursing care, your ethics, and all of that is just something that you're wanting to share with other person. You experience different culture, you experience practicing medicine in a different environment from what you're accustomed to. It can be eye-opening sometimes, but it comes with you being flexible and adaptable in your nursing role. Nursing in the US comes with its many benefits, such as higher nursing salaries. Yes, there's always going to be competition for which health system or which hospital is going to be paying their nurses more. And so wherever more money is, you have people navigating to that area. And it's no different with the health system or with nurses or healthcare workers. Wherever they're going to be paid better, the benefits are going to be better, they're going to be going there. In the US, there are so many health systems available. And so there is always opportunity for growth. There is always going to be career development. You are able to climb that ladder of success because there's always going to be positions that are available that you feel that you are more qualified to do. And so there is a big playing field out there with health systems that you can actually choose to go ahead and expand your career. There is also going to be cutting edge technology that is available. The US is always creating, researching, and developing medicines, equipment, things to make your life easy, things to make patients better, medications. And so you find yourself being a part of that environment where you'll be using all of these cutting edge experiences or technology to make your life a little bit easier in terms of getting the best results for your patient. There's also going to be better job security because, as I say, you can have 10, 15 different hospitals in one different location, and you can actually always just jump over to this one and say, okay, let me go over there and try out this one. If it doesn't work out for you, you do not like it, there is always 9 other hospitals in that little area that you can always choose from. So there's always going to be the opportunity for you to secure a job, at the end of the day when you transition here. However, working as a nurse from abroad or working abroad as a nurse comes with its challenges as well. And that includes the challenge of the language. Language barrier is a big thing. English, a lot of persons, we do speak English, but our English in one country is totally different from the English in another country. What you might mean to say in another country might be taken wrongly in another country. And so you have that barrier, that language barrier that you have to deal with, despite, it's the same English that you're speaking. Nurses are trained differently, and so, when you have a certain work ethic, you come out and you do your best at what you're doing. But sometimes because of a language barrier, how you sound, how you go about doing certain things, persons can mistaken it for something negative. And so that can be an issue that you might be faced with. Cultural differences is another one because, as I say, in your culture, you're accustomed to doing this, and then you come to another culture and then this is the norm here. And so you have to try and adjust yourself to fit in with that culture to ensure that everybody is of the understanding that this is what it is. This is the expectation. This is what you're doing. So nobody can take it wrongly that you're, being disrespectful or anything like that. So ultimately, the decision to work abroad versus the US comes with, your personal preferences and your ability and willingness to experience working in a new country. And embrace those new changes. For now, if you have any questions or any concerns regarding working in the US here, you can always reach out in the questions below. you can always go ahead, send a message over, and hopefully I'll be able to answer those questions as best as I possibly can from my experience here in the US. I do want to say thank you so much for tuning in. And as usual, if you haven't subscribed, now is the time to please go ahead, subscribe to the channel, turn that notification bell on so that way you can be a part of this channel. Thank you for joining in, and I'm so happy that you're here. Bye.